In planning for discharge, you may need to assist your loved one with care. Family teaching days may be scheduled by the case manager to arrange for you to come in and spend time with your loved one in the hospital before they come home. You'll follow the person through their day and work closely with their therapists and the case manager. It's important that you wear comfortable clothing because you will be asked to move freely and help assist with their mobility during the training. A typical day would include spending time with the occupational therapist, physical therapist, and possibly a speech therapist if the services are provided. You'll be assisting with the patient's self-care, such as toileting, bathing, and bathroom transfers, how to get them in and out of the car. You'll assist them with going up and down stairs if that's necessary, and be provided with education about the care and management of equipment at home, such as walkers, wheelchairs, and lifting devices. A therapist will be asking you about your home and the layout of the home to be able to help you make arrangements and recommendations for modifications. The physical therapist will focus on mobility, so that will include standing and balance. It will include transfers in and out of the bed and in and out of a car, going up and down stairs, and using a wheelchair if necessary. They will also focus on increasing endurance and range of motion and setting up a home strengthening program for the person to continue after they go home. Equipment that the physical therapist may prescribe includes a walker, a wheelchair, specialty cushion and back if needed in the chair, a lifting device, and then education about using these devices. We will provide the ordering of the equipment prior to your loved one leaving, and then explain the delivery process before you are finished with the family training. The occupational therapist will focus on activities of daily living. That includes things like bathing, dressing, grooming, and feeding. It will include assistive devices that can help with that if there's a need. There also may be cognitive training included in the training with the occupational therapist that could include things to help with memory, problem solving, and cognition. Vision may be addressed by the occupational therapist too, and exercises may be explained to help a person with visual deficits and improving that. Activities around the home may be explained, including meal planning and setup, home management, and laundry. Equipment that the occupational therapist provides and prescribes may include a shower chair, a power wheelchair, and seating for that power wheelchair, and then education and use about the devices that they recommend. If appropriate, and your loved one is being seen by a speech therapist, then the speech therapist would also spend time with you during your family training session. Swallowing food and liquid is important, and it's important to be able to do safely, and so the speech therapist may provide recommendations to you about how to prepare certain foods or purchase thickeners for liquids so that your loved one can eat and swallow safely. Diet levels may be reviewed, and then recommendations for a possible altered texture or liquid thickness to improve the safety with swallowing may be shared. It's important for you to learn about the diet recommendations so that you can ensure your loved one will be safe at home. There are 4 diet levels of food at Magee: regular, soft or cut up, ground mechanical, and pureed. And there are 3 liquid levels at Magee. They include thin liquids or regular, nectar thick, and honey thick. The speech therapist will explain where your loved one is and what will be safest and most beneficial for them to eat and drink. A speech therapist may also explain communication strategies if your loved one is having difficulty with either verbal or nonverbal communication, and also a home program that you can use to be able to communicate effectively together. And finally, the speech therapist may also explain and provide information about cognitive strategies and skills that will help with memory and attention And so these skills may also be things that you can use in the home environment to be able to communicate well. Thank you.